Healthcare is an essential service for the inclusion of persons with disabilities who, according to the 2010 law, are supposed to receive a medical bill waiver. However, ignorance of and the slow implementation of this law leaves persons with disabilities very frustrated when trying to access health facilities for medical attention. But what exactly does the law say?
The law says that the Ministry of Public Health is supposed to ensure the prevention, the detection, and the management of cases of disabilities. They have to take measures to ensure that persons with disabilities have health services, either through giving them free services or affordable health services that is taking into consideration their means.
The law of 2010 from Articles 19 to Articles 23 lays down regulations that guarantees fair treatment to persons with disabilities when it comes to access to health. And specifically in Article 22, where the law says any destitute person with a disability who is a holder of a national disability card will benefit from free consultation, free hospitalization, and the free provision of drugs. It goes further to say in cases where you need orthopedic, imagery, or X-ray, all of this is covered by this regulation and it's supposed to be for free.
According to persons with disabilities, they hardly benefit from the waiver, and in institutions where the waiver is respected, the procedures to benefit are cumbersome.
It is being said when you have your national disability card, you as a person living with disability, they will take you free. But I once went to the preventive for checkup. I was told to pay fees for consultation. I should pay fees for lab tests and so on. I told them, please, I'm a person living with disability. They say no, they don't know about that. Really, I was really crushed.
At times they'll tell you that there is free consultation. What is the cost of consultation and the cost of lab tests? What is the cost of hospital bill? Which one is better? We want free health care for people with disability.
In urban areas where there is intensive advocacy and consciousness, persons with disabilities do benefit from some free services. But in the rural areas where knowledge on these regulations is limited, the persons find it difficult to benefit from the services that are provided. Remember that it needs the intervention of a social service for you to benefit from all of these free services. And in most of our settings, you hardly find the social centers attached to the various services, therefore making it very difficult for persons with disabilities to benefit. Imagine that you are going to the hospital for consultation and you are going to the social service for social inquiry to be conducted. Before they conduct it, maybe you must have, or your situation might have gone worse. So we just hope that if regulation simply says if you are a holder of a national disability card, all of these services are provided to you, then fine.
Notwithstanding, few health facilities are implementing this law, though very timidly.
In some services, especially the regional hospital of Bamenda, where we have a social service, persons with disabilities benefit from some free services.
It requires that a social worker should be able to carry out an assessment to determine whether they are vulnerable or they are not vulnerable. And I think that is being done at the level of the regional hospital, Bamenda. But the main challenge is that we don't have social workers in all health structures.
Most persons with disabilities tend to need more medical attention than those without disabilities because of the impairments. This increases their financial burdens, which most of them cannot afford, as they usually constitute the poorest of the poor in the society. Benefiting from free medical bills will reduce this burden as well as encourage destitute persons with disabilities to seek health care. This will prevent them from having future disabilities and also serve to rehabilitate those who already have severe disabilities. Thus, there is a need for health authorities to put in place strategies that would ensure the respect of the medical bill waiver at various health institutions.